5 of California's top doctors in state government have received the Johnson & Johnson COVID-19 vaccine, an act taken jointly in front of news cameras as officials seek to promote the most recently approved shot. Federal and state scientists have been focused recently on touting the benefits of the Johnson & Johnson vaccine, a single-dose shot that has provided virtually 100% protection against the kind of life-threatening COVID-19 disease that leads to hospitalization and death. Officials have been trying to boost public confidence in the vaccine because, at the time the clinical trials were conducted, the Johnson & Johnson shot was only 72% effective against moderate to severe infection in the U.S. That's an impressive percentage compared with the flu vaccine, but officials are concerned that the public will avoid taking the Johnson & Johnson shot to wait for the vaccines made by Pfizer, BioNTech and Moderna. Those shots, which require 2 doses, were tested earlier in the pandemic, before the wider distribution of worrisome variants, and were found to be more than 94% effective in preventing people from getting sick at all. Officials say it's impossible to compare which vaccines are more effective precisely because they were tested at different points in the pandemic. What they do know is that all 3 vaccines currently available in the U.S. offered extraordinary protection against hospitalizations and deaths from COVID-19 in clinical trials. Health officials are urging people to take whatever vaccine they're offered when it's made available to them. What authorities do not want is for people to decline the Johnson & Johnson shot to wait for the Pfizer or Moderna shots. Such a delay would further increase the risk of a 4th wave of the pandemic and give more time for the virus to mutate and produce new variants. I'm excited to have had a chance to get vaccinated with the Johnson & Johnson vaccine, Dr. Mark Ghaly, the California Health and Human Services Secretary, said Thursday at the Baldwin Hills Crenshaw Plaza Mall in Los Angeles, which is hosting a vaccination clinic. Any vaccine that you have a chance to get is the right vaccine for you. The Johnson & Johnson shot is highly effective at preventing the worst complications of COVID, severe disease, hospitalization, death, Ghaly said. At the enormous federal vaccination site at the Oakland Coliseum, 4 other top state doctors were given the Johnson & Johnson shot, the director of the State Department of Public Health and State Health Officer, Dr. Tomás Aragón, the California Surgeon General, Dr. Nadine Burke-Harris, the state epidemiologist, Dr. Erica Pan, and Dr. James Watt, the state's chief of communicable disease control. One benefit of the latest vaccine is that studies have confirmed it is fairly effective, 74%, at preventing vaccinated people from becoming asymptomatic carriers of the virus, Aragón said.